All right, so you're here to understand things quickly and efficiently, and we're jumping right in today with a common issue that I think a lot of people have questions about and might even be a little bit embarrassed to even look up. But we're going to talk about genital warts today.
Okay.
And we've got some really good information here from the Ghana Standard Treatment Guidelines.
Oh, wow.
And I was reading through this, and there's a ton of great information here. And I really think we can pull out some of the really key stuff, the stuff you need to know, and kind of cut through all that medical jargon.
Yeah, definitely. I think these guidelines can be really helpful. They're like a roadmap to help you understand this condition a little bit better.
Exactly. And I like that you call it a roadmap because we're going to highlight kind of the key landmarks in this roadmap today.
Absolutely.
So let's start right at the beginning. Like, what is it that causes genital warts according to these guidelines?
Well, the guidelines are very clear that the culprit here is the human papillomavirus, or HPV, as it's more commonly known. Yes, it's a virus. And certain types of this virus can actually lead to those changes in the skin in the genital area that we know as genital warts.
Okay, interesting. And I think it's important to point out that, a lot of people might have HPV at some point in their lives, but it's not every type of HPV that causes the visible warts, right?
That's absolutely right. Only specific strains are associated with the development of those warts.
Okay, so HPV is the trigger. And then what happens next? So do you always know if you have genital warts?
Well, that's the thing. One of the tricky aspects of genital warts is that a lot of people who are infected with the types of HPV that cause them may not even have any symptoms.
Really?
Yeah, they can actually have a completely silent infection for quite a while.
Wow, that's a little bit scary. Yeah. So if they do show up, what are we looking for here? What do the guidelines say about how these things appear?
Okay, so when genital warts are visible, they're described as small swellings in the genital and anal areas, and they're typically painless. Mm-hmm. Now, they can look a little bit different. Some are flat, some are raised. Some might even have a little stalk or stem-like appearance.
Oh, okay. Interesting.
And the color is usually very similar to your normal skin tone.
Gotcha. So it can blend in a bit. So we've talked about the appearance, but where exactly on the body can you find these?
Well, guidelines give us specific locations. We're talking about the penis, the vulva, the vagina, even inside on the cervix, the urethra, and around the anus. So basically anywhere in that genital region.
Okay, that makes sense. And are there any other signs that someone might experience besides just seeing the warts themselves?
There can be, and the guidelines mention a few possibilities. Some people might feel some itching, some general discomfort in the area, perhaps an increase in vaginal discharge, or even a bit of spotting or bleeding during or after sex.
I see. So it's not just the warts themselves. Now, I noticed a term that popped up in these guidelines, and I'd love to get your take on it, the vinegar test. What is that all about?
Yes. The vinegar test, or more formally, the acetic acid test. It's basically a diagnostic tool that healthcare providers can use. It involves applying a mild vinegar solution to the affected area.
Okay.
And what happens is certain types of warts will temporarily turn white after being exposed to the vinegar.
Oh, interesting. So it's like a visual aid for diagnosis.
Exactly. It can help highlight the warts and make them easier to identify.
That's pretty clever. Okay, so let's say someone suspects they might have genital warts. What's the main goal of treatment according to these Ghana Standard Treatment Guidelines?
Well, the primary objective is pretty straightforward. The goal is to get rid of those visible warts.
Makes sense. So what are some of the ways that you can do that?
Well, the guidelines outline both non-pharmacological and pharmacological approaches, so with and without medication.
Okay, let's start with the non-medication options. Right. What do the guidelines recommend there?
They emphasize the importance of protecting the healthy skin around the warts when using topical treatments. And for that, they suggest something as simple as Vaseline to create a barrier.
That's interesting.
And for some specific creams like podophyllin and imiquimod, they give very clear instructions on how long to leave them on before washing them off. For example, podophyllin should be washed off after 1 to 4 hours, while imiquimod needs to stay on for 6 to 10 hours.
Okay, so that's really important to note the specific instructions for each treatment. Now, besides these creams, what other non-drug options are there?
Well, they mention a few other methods like cryotherapy, which is basically freezing the warts off. This often requires multiple sessions spaced about 1 to 2 weeks apart.
Okay, and how effective is that?
It can be quite effective, but it might take a few treatments to get rid of the warts completely.
Gotcha. And are there any other options besides cryotherapy?
Yes. They also list electrosurgery and surgical removal as more direct ways to remove the warts.
So those are kind of the heavy hitters?
Exactly. When other methods haven't been successful, or if the warts are particularly large or numerous, these options might be considered.
Okay, so we've talked about the non-medication approaches now. Let's move on to the pharmacological treatments. What are some of the key things to know there?
All right, well, the guidelines detail a few specific medications for treating genital warts. The first one is podophyllin, which is applied directly to the warts weekly.
Okay, podophyllin weekly.
Yes, and it's important to avoid getting it on the surrounding healthy skin.
Right, that makes sense. Protect that healthy tissue.
Exactly. Then there's trichloroacetic acid, or TCA, which is another option, also applied weekly, but again, very carefully to avoid any contact with the normal skin.
Okay, so precision is key with these treatments.
Absolutely. After applying TCA, it's recommended to use talcum powder on the treated area.
Okay, interesting. Why is that?
It helps to absorb any excess acid and prevent it from irritating the surrounding skin.
That makes sense. C. What does that mean exactly?
That's a good question. The C rating basically indicates that the evidence supporting these treatments comes from smaller studies or expert consensus.
So not necessarily large-scale clinical trial.
Right. It doesn't mean they're not effective, but it just means that the level of evidence is considered lower compared to treatments with an A or B rating.
I see. So it's something for healthcare providers to keep in mind when recommending treatment options.
Exactly. Now, besides podophyllin and TCA, there are a couple more medications worth mentioning. One is podophyllitoxin cream, which is used more frequently, like 12 hourly, 3 times a week, but for a shorter period of 4 weeks.
Okay. And what about the last one?
The last one is imiquimod cream, which is applied 3 times a week for a much longer duration of 16 weeks.
Wow, that's quite a difference.
Yes, and with imiquimod, it's important to wash it off after 6 to 10 hours.
So again, very specific instructions for each medication. Are there any particular warnings or things to be aware of with any of these treatments?
Yes, absolutely. There are some important cautions to keep in mind. For instance, TCA is not recommended during pregnancy or breastfeeding.
Okay, that's really important to know.
Definitely. And both podophyllin and TCA should not be used to treat warts on the cervix.
So those are some key contraindications to keep in mind. So just to kind of recap what we've talked about today, we've learned that HPV is the underlying cause of genital warts. The symptoms can vary, and sometimes there are no symptoms at all.
Right.
But when symptoms do appear, they're often small growths in the genital or anal area. And we've talked about a variety of treatment options, both topical and procedural.
Exactly. And it's really fascinating to see how these standardized guidelines lay out this very structured approach to managing this condition, even something as common as genital warts.
Absolutely. And I think what this really highlights for me is the value of having these types of resources readily available. You know, these guidelines can provide really clear and consistent guidance for both healthcare providers and patients.
Absolutely. And I think it really prompts us to consider how often we overlook these evidence-based recommendations that are out there.
Yeah.
You know, in a world that's just flooded with health information, it's crucial to know where to find the most reliable and trustworthy sources.
Yeah, I totally agree. Well, thank you so much for breaking all of this down for us today. This deep dive into the Ghana Standard Treatment Guidelines has been incredibly informative.
My pleasure. It's been a great discussion.
And for our listeners out there, you know, this conversation really makes you think about how even seemingly straightforward health conditions can have some nuances in their management. So always remember to consult with your healthcare provider for personalized advice and treatment.
And on that note, it's worth pondering how we can all become more proactive in seeking out and understanding those established medical guidelines that are out there. After all, knowledge is power when it comes to our health.
Absolutely. Thanks again.
You're welcome.